Study with me. I'm sitting for the CNA exam. I'm looking at the nursing assistant care, the basics, Hartman's. I'm looking at chapter 1 and 2, and we're going to be reading it. Mostly because I need to pass the exam tomorrow, and reading it helps me. The nursing assistant in long-term care. 1. Compare long-term care to other healthcare settings. Welcome to the world of healthcare. Healthcare happens in many places. Nursing assistants work in many of these settings. In each setting, similar tasks will be performed. However, each setting is also unique. This textbook will focus on long-term care. Long-term care, LTC, is given in long-term care facilities for people who need 24-hour skilled care. Skilled care is medically necessary care given by a skilled nurse or therapist. It is available 24 hours a day. It is ordered by a doctor and involves a treatment plan. This type of care is given to people who need a high level of care for ongoing conditions. The term nursing homes was once widely used to refer to these facilities. Now they're often known as long-term care facilities, LTCFs, skilled nursing facilities, SNFs, rehabilitation centers, or extended care facilities. Basically, they categorize things instead of generalizing it. People who live in long-term care facilities may be disabled. They are often elderly, but younger adults sometimes require long-term care too. They may arrive from hospitals or other healthcare settings. Their length of stay, the number of days a person stays in a healthcare facility, may be short, such as a few days or months, or longer than 6 months. Some of these people will have a terminal illness. This means that the illness will eventually cause death. Other people may recover and return to their homes or other care facilities or situations. Most people who live in long-term care facilities have chronic conditions. This means the conditions last a long period of time, even a lifetime. Chronic conditions include physical disabilities, heart disease, and dementia. It's important to note here that Alzheimer's is part of the subset of dementia. People who live in these facilities are usually referred to as residents. These places are their homes for the duration of their stay. People who need long-term care will have different diagnoses or medical conditions determined by a doctor. Another thing to note in the chain of command is in the United States we have more nurse practitioners and physician assistants when we go receive medical treatment instead of actually seeing a doctor. The tasks nursing assistants perform will also vary. This is due to each resident's different symptoms, abilities, and needs. Other healthcare settings include the following. Home health care, or home care, is provided in a person's home. This type of care is generally given to people who are older and are chronically ill, but who are able to and wish to remain at home. Home health care may also be needed when a person is weak after a recent hospital stay. Home care includes many of the services offered in other settings. I think the great thing about home health care is it's a little bit of autonomy for the person to decide how they want to get treated, and in familiar surroundings. They are more independent in that sense. Assisted living facilities are residences for people who need some help with daily tasks, such as showering, meals, and dressing. Help with medications may also be given. People who live in these facilities do not need 24-hour skilled care. So, an example of this would be a patient who is starting off with Parkinson's, some tremors, might need some assistance, dressing with meds, but doesn't need someone there 24/7. Um, a resident can live in a single room or an apartment. An assisted living facility may be attached to a long-term care facility, or it may stand alone. Adult day services are for people who need some help and supervision during certain hours.